So let's look now at section 1, getting started. And in getting started, we on the beginning of each section, we talk about the activities that you're going to be completing, and then we go into the worksheets. So each section, first, this is what you're going to be covering, and then we go into the worksheets. And so we know that you're adult learners. We know that some of you are expert in many of these things that we'll be covering, but what we want you to do then, if you are already an expert in, say, delegation and supervision in your Nurse Practice Act in your own state, we'd like you then to just review the material and then make sure you know where the resources are, so that should someone address you and ask about this, because you'll have your pin on that shows that you're a professional practice specialist, you'll know where to get those resources. Okay? So we trust that you're going to just delve deeply into the material that you need to, and skim the things you don't need to. So the activities that we'll be completing in section 1 include completing your personal commitment worksheet, reading in the ROC manual, and also completing these worksheets and looking at the Code of Ethics in your professional specialty or the American Nursing Association Code of Ethics would be another thing you might want to review. Okay, so activities in section 1, getting started. Your personal commitment is worksheet 1. This is very easy, but the reason we include this here is for us to be very clear about the kinds of ethics that we want people to be involved in when they're in a professional practice specialist program. We'd like you to make a commitment to contacting us if you have questions and concerns, trying to engage with your colleagues by the teleconference and in other ways, and also to really put as much effort as you can into completing of the program. The next step then that you're going to be doing is the worksheet number 2, which are the goals, the level 1 goals. We ask you to think about goals because we want you to focus on results, just as we ask our patients and families to focus on the results that they would achieve in their next 8 hours or their next 2 hours, and then their long-term goals as well. So we know that they may change, just as at the beginning of the shift maybe the patient's goal is to relieve their nausea to 0 and to have only a level 5 or 4 of pain. We know that that might change once the pain is relieved, and they might be worrying about something else, but we do ask you to think about what are the topics that we're going to be covering over in the whole program. Look through your portfolio, look at the topics, figure out where you have strengths and weaknesses. And when you do your online professional practice survey, we've sent you that URL on your agendas. We'd like you to take that information and help you develop the goals that you might have for yourself. We'd like you also to discuss those goals with your supervisor or leader that might be sponsoring your program, just so they know what you might be working on and they can support you in that process. We may be asking you at the end of the program when we are doing our oral testing about whether or not you achieved those goals and what were those goals. Okay? We want you to really connect with your personal 4 Ps, your own purpose, picture, plan, and part, and to really address whether or not you're moving in the direction you want to professionally. Don't often get time to do this on a daily shift. So worksheet number 3 is storytelling. One of the main themes that goes through our professional practice program is the idea of stories, the patient's story, your story, and to realize that the way that we really share who we are as individuals, as humans, has to do with the stories. And so the stories that you have about your practice are very important, and we want you to submit one of those stories by the end of the course or at the end of the course, so that there's an example of your practice and what's meaningful to you that will be assembled in a compendium with your colleagues that are attending from your same organization, and then that will be sent to the sponsor of the coursework for your organization. We give some examples of stories here. We talk about a story that occurred in my own practice, where I was working with an organization and I was asking the nurses to sit at eye level at the bedside and talk to the patients about their goals or what results they were looking for. And there was a nurse who was really not happy because she had worked the evening shift the night before and she really wasn't interested in coming in for a class, which I could understand. But she was kind of negative throughout the day, and I asked her to go out and actually do a very fast, 2 to 3 minute interview with one of her patients that she had had the last evening and ask about what was most important for him, and really to look at his priorities and find out whether or not this organization, this hospital, was achieving those, helping him achieve those goals. She came back in and she had a very interesting look on her face, and I asked her about her experience. She said, "You know what?" She said, I couldn't believe it. The patient didn't know who I was. I asked him what was most important to him, and he said, "You know what? Just this, for somebody to actually sit and talk to me and look me in the eye and talk to me about my care." And he had been in that organization on several different floors, and that had never happened. He didn't know her name either, and she said, "I did introduce myself." But he didn't remember because there was no personal connection with the nurse and the patient. So that was one of those life-changing experiences for her as a nurse, and it was also a good learning experience for me as a person who coaches care at the bedside, to know that it's important for people to actually practice this professional specialist types of skills in order to see how well they can implement them in their own area, in their own shift. So, the stories. There are other stories that are present on our blog if you want to get some examples and read some of the stories. So this is worksheet 3. You're already at worksheet 3, right? So we have a sheet here on worksheet 3 so you can make some notes about your stories. Certainly you might want to put them on an electronic document, or you can write them longhand. That's fine. We can, you can scan them and send them to us. But that is one thing we want you to submit to the ROC office. Section 2, personal assessment. We ask you to do an awful lot of reflection and thinking about your own practice during this course. We asked you already in your attached to your agenda that you received before the first conference call was a listening style assessment. We ask you to look at your professional practice, or if you're in a leadership or management role, I believe all nurses are leaders, but if you're in a management role, that supervisory role on your name badge, we'd like you to actually also conduct the survey and to respond, as it states in the survey online, to respond as to what you see happening in your own area that you lead. We're going to ask you also later on in the coursework to look at your conflict resolution style and some other styles of working with assertiveness and dealing with conflict, and even how far you are in your professional practice from novice to expert. That's in the clinical delegation skills book. There's an assessment there. So what we're asking you to do then in your personal assessment is to think about your learning styles as well. So in worksheet 4, there's several different URLs that you can go to look at your learning style and find out what the implications are for you in the coursework, as well as how you lead and teach others and communicate with others, your patients and those that you lead on the floor or in the units. On worksheet 5, that's your learning styles journal, so you can talk about some of the issues that you might want to address in your work. And then we move into section 3, professional practice, and we'll talk to you more about that on another video. So thank you so much for joining us for this overview of sections 1 and sections 2 of the Professional Practice Specialist Program. We'll be talking with you soon.